Toast the holidays in a new way and raise a glass of rum chata, a delicious creamy blend of horchata with rum. Enjoy it over ice or in your coffee. Rum chata, your holiday cocktails just got sweeter. Tap or click the banner for more. Drink responsibly. Caribbean rum with real dairy cream, natural and artificial flavors. Alcohol 13.75% by volume, 27.5 proof. Copyright 2025 Agave Loco Brands, Pewaukee, Wisconsin. All rights reserved.
Kids. They grow up so fast. One day they're taking their first steps, and the next, they don't fit into the tiny sneakers they took them in. You blink your eyes and their princess dress is 2 sizes too small, and their dinosaur backpack isn't cool anymore. But don't cry because they're growing up. Smile, because you can profit off of it. For real, there are a bunch of parents on Depop looking for the stuff your kid just grew out of. Download Depop to start selling.
Well, hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. In this shorty episode, we're talking about cyanosis and basically the difference between central cyanosis and peripheral cyanosis. So first, let's talk about what cyanosis is. It is that bluish discoloration of the skin or the mucous membranes caused by reduced oxygen levels in the blood. In some skin tones, this could be not so much bluish, but more of a pale color. If you want to learn more about assessing skin signs in patients with varying skin tones, I do have an episode about that, and it is episode number 349. So definitely take a listen to that. So we are discussing central and peripheral cyanosis, starting first with central cyanosis. This is a problem with oxygenation at the systemic level. You'll see that discoloration in core areas like the lips, the tongue, the mucous membranes. So when you're thinking about central cyanosis, think about respiratory or cardiac conditions like hypoxemia, congenital heart disease, or pulmonary edema that's pretty significant. So again, central cyanosis indicates low arterial oxygen saturation. It's a serious sign that oxygen isn't getting where it needs to go. Now, peripheral cyanosis, on the other hand, occurs when oxygen delivery to the extremities, those tissues, is reduced, while central cyanosis could actually not be present at the same time. It could just be peripheral cyanosis. You'll see that discoloration in the hands, the feet, the fingers, the toes, and the causes of peripheral cyanosis are often poor circulation. This could be due to things like low cardiac output, cold exposure, or peripheral vascular disease. So the key point here is that peripheral cyanosis is usually about perfusion, not because of like an underlying respiratory disorder causing systemic oxygenation problems. So here's a quick example. You've got a patient with COPD who's having a very serious exacerbation with very low oxygen levels in the blood. You'll likely see central cyanosis. What about your patient who is very cold and who has poor perfusion because of vascular disease? They're likely to have peripheral cyanosis. So the next time you see cyanosis or it comes up on an exam, ask yourself if it's central or peripheral, and then you can kind of think through what the underlying problem could be. I hope that helps, and I will see you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
And Doug. Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu? Is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.